assessment to test neurologic functions. Perfect. If everything's set up, let's wait for the patient now. Oh, hello there, and welcome to Dream City Clinic. Pleasure to meet you. Yes. I am Dr. Brain, and I am the neurologist here at Dream City Clinic. Yes. And who might you be? Thank you. I'm just going to write a couple notes down with your name here. And your name is beautiful. Do you spell that with an I or an E or? And do you know your birthday? Good. And when was the last time you were seen by a specialist? It's been a little bit. Okay, don't worry. Now, just to begin with, we're going to be doing something known as a cranial nerve examination. And we're focusing on something known as an objective vestibular assessment. Because I was reading your notes from the nurse, and it said here that you are experiencing what is known to be tiredness, and you haven't been getting the best sleep. Okay. And it seems that you also may have a little bit of difficulties falling asleep fast and staying asleep. Okay. What will help you here today? This is also a part of the exam. So we're going to get you all relaxed. If you could please, for me, sit right on the medical exam chair that's about 1 meter in front of me, just right there. Yes, good, very good. And if you'd like to just lay back, very good. And step 1 for this as well is to relax your shoulders. May I just carefully touch your shoulders? Okay, I'm going to carefully just touch your shoulders here, okay? I want you to relax them because this is the part of the cranial nerve, okay? Good. Now, if you would like to just gently and carefully relax yourself, you may. And if you fall asleep, it's no big deal, okay? Good. And have you ever had a cranial nerve exam before? Perhaps. Okay. And one more question before we begin the actual assessment. Have you fallen, hit your head, or done extreme exercises? Okay, then proceeding with that question, have you been extremely stressed either due to school or work? Okay, because those can all relate to fluctuations with your cranial nerves, so we will do all the assessments we can do, okay? You're all signed in now. I'm just going to get a glove on. And one more. And how was your day, your evening? It's pretty late. Okay. A little bit stressful. I've got you. No worries. Gloves are on. The first thing we're going optic cranial nerve. That's with your eyes, okay? I'm gonna ask you to carefully look at my finger. Okay? And I want you to follow my finger with your eyes only. Can you do that? Look over here. Follow my finger, look over here. Okay, and look back at the center, look right there. Very good. I'm going to ask you, is my finger getting closer to you or farther away? We're going to start off right here and let me know, is my finger getting closer or farther away? Closer or farther? Closer, very good. Beginning at the center again. Closer or farther? Closer, good. Closer or farther? Farther, very good. Closer or farther? Good. Closer or farther? Closer. Very good. You're doing great. I'm gonna get a pen light now. And I'm going to be checking parts of your optic nerve. And then we'll move on to the Snellen's chart behind me, okay? I'm gonna cover one part of your eye. And a part of the vestibular exam as well. We'll be doing the light for me. Good, just stare at the light. Very good. And is the light getting closer or farther? Closer, very good. And is the light getting closer or farther? Farther, very good. I'm going to switch to the other eye now. I'm going to place this on your eye again, okay? Let me know, is it getting closer or farther? Closer. And is the light getting closer or farther? Closer. Very good. I'm going to carefully turn off the lights here now. And we're going to do the exam with the Snellen's chart behind me. Okay. So, what I have here is a Snellen's chart with you sitting right there in front of me. I'm going to be using my pointer, and you have to let me know what letter you are able to read. Are you ready? Let's begin. So, looking up at the chart right here, are you able to see the first letter? Let me know what letter that is. That is an E. Very good. Okay. Are you ready for the second letter? Let's begin. What letter is this right here at the center, third line? Let me know. That is an O. Very good. One more letter now. What letter is the last letter above the green line? Can you see that? It's this letter right here. What letter is that? Focus carefully. It is very good. That is the letter P. Good job. Now, I'm going to ask you, focus all of your eyes on the Snellen's chart. Tell me the lowest line you're able to read, okay? I'm going to ask you just to carefully focus, but don't strain your eyes, okay? So look at the chart behind me. Are you able to assess which is the lowest line you're able to see? Okay, and can you read me the letters? Okay, so yes, either above or below the green line. It's a little difficult. Okay, very good. I'm going to do another test now. I'm going to put one hand over your eye, okay? I'm going to put one hand over your eye. Okay. Can you see the Snellen's chart now? Okay. Are you able to assess it? Not really. I'm going to remove the hand over your eye. And can you assess it now? Yes. Once more, I'm going to cover the other eye. Okay. Right there. And is it still the same effect where your vision gets a little bit blurry? Okay, and what about now? Good. And let me know, when does the vision get blurry? Let me know when. I'm going to put my hand close. Are you ready? Begin the assessment. When does the vision behind you get blurry? Here. Okay. Once more. Let me know when the vision gets blurry. There. Good. And one more time. There. Very good. Now let me know the opposite, when the vision gets all focused. We're going to begin here and we're going to work the way backwards. There. Once more, let me know when. There. And once more, let me know when. There. Very good. I'm going to turn on this light now just a little bit brighter, okay? Amazing assessment. Thank you for focusing on the Snellen's chart behind me, okay? Now I'm going to give you what is known as the Ishihara test. I'll show you the little pamphlet in front of me. I have the medical color deficiency test. Do you have color deficiency in your eyes? Or are some sort of colors you're unable to assess. Okay, I have that too. I have that too. So no need to be embarrassed. I cannot see several shades of pink or purple. Yeah, so nothing to be embarrassed about because I have that too. Yeah. I'm going to pull out 3 of the photographs here, and you'll know exactly what these are. You maybe have done these in primary schools before, and they are simple color assessment papers. So we're going to begin with this one. I'm going to show you a chart here, and this is the Ishihara Color Assessment Level 1. If you can see here, there is a circle filled with dots. Are you able to see that? Amazing. Now, are you able to assess what color most of the dots are? Good, they are red, yellow, and orange. And are you able to assess what color this is? There's an object hidden in this painting. Good, the hidden object is the letter 7, which is right here, filled out with green. Were you unable to see the letter 7? Okay, and that's okay. Remember, all of this is okay. There are no right and wrong answers here. I'm just here to assess you. Yes, this also works perfect for the vestibular objective assessment that I'll be using later. Good. On to the second level. This is level 2. This is more difficult than level 3 in my opinion because I cannot see some colors. I have a chart right here. We have a green circle. Can you see that? And again, there is a hidden object within the painting. Can you tell what the color is of the objective number that is hidden in the painting? Very good. That is, yes, it's a bit of a brown and a yellow. Can you read what number that is right there? Good. That is a 9. And what is that? That is a 7. Magnificent. This one is a bit more difficult for me to read, so I do have a cheat sheet behind the paper so I can tell you. And here's the last one. I think this one's easier than level 2, but most people think it might not be. Here you go. Here's level 3. We have another painting here with an object and a number hidden inside the painting. Are you able to see the background of this? Good, and what color is that? Perfect, it's almost like a black and a gray. Very good. And are you able to see the hidden numbers between the back? Good, and what is this? What is that right there? That is a 3. Keep your eyes on it. Good, and what is it? That is a 5. Keep your eyes on it. Very good. I'm going to ask you now, are these the same color or are these different colors? Okay, good. The 3 is pink and red. The 5 is purple and pink. Good. I'm unable to assess this card properly because I cannot differentiate those colors. So amazing job. You're doing great. And we're going to quickly do a pupillatory response test. I have my pen light here once more, and I'm just going to shine the light carefully on your pupils. I'm going to drop the light again. And I'm going to see. I turn the lights down. We're just going to test your pupils, okay? Beautiful. Pupillatory response is acceptable. And other eye there. Good. Great. Fantastic. Your pupils seem to be assessing properly with this. I'm just writing notes down. Okay, we're going to move on now to the nose exam. This is called the olfactory sensory nerve exam, which is the sense of nose and taste. And this is to test your anterior fossa of your nose. And it's test to see if you can differentiate between certain smells. And this is about the first and the fifth cranial nerve, okay? Good. So, what I have here is a set of only 3 essential oils. They all have differing odors. There's no correct answer. I want you to identify which or what the essential oil is, but please keep your eyes closed and don't look. Okay? You promise? Good. Now the first one here, I'm just going to open the essential oil. I think it smells fantastic. I'm going to ask you to close your eyes, and I want you just to take a guess. There are no correct answers. What do you think this essential oil is? Okay, and it smells like mint, a bit like soap. Perfect, and a bit like... Amazing. So you think this one could be mint? Good, this one's eucalyptus. So it looks like the anterior fossa is able to identify the mint. Good job. On to the next one, okay? Now keep your eyes closed for this one. I adore this one. Quite lovely indeed. So, no correct answers, just take a guess what you think it could be, okay? This one's a bit more calming, okay? And this one is a bit like floral. Again, a bit like soap, okay? And maybe a bit like... Okay, yes, a bit like a sleepy time tea. Very good. Any guesses? Very good. You were close. This one is lavender. It's more of an English lavender. A bit more lemon. It's actually quite nice. Good job. So that functions properly. And now we have the third one here. And this one is a bit more unique. It's the most difficult in my opinion. Okay. I adore this one. My goodness. Keep your eyes closed. Now what do you think this one could be? This one is a bit more unique. Okay, it reminds you of perhaps coffee. Very good. Okay, perhaps, okay, like a cake. And maybe like a cupcake. Any guesses? Cupcake? No. This one is vanilla. You can open your eyes again. Amazing job, by the way. That was fantastic. So it seems that you're able to identify odors such as it would appear to be essential oils. I would even consider some to be base notes. We typically look for soap, coffee, and clove. But I will switch it up so that you don't guess the most easiest things, okay? Good. Next is the taste test. And what I'm doing here is I'm going to ask if you can ascertain if the taste is sweet, sour, or spicy. Okay? Let me get the bottle. You won't be able to tell from the bottle, but here's the bottle. I'm going to put 1 drop on your tongue. Okay? And we're going to guess if it's sweet, sour, or spicy. Okay? Good. So let me just... Okay. Now say ah. Place 1 little drop. Good. And then if you could do this. Good, do that for me. Magnificent. And that is spicy. Amazing job differentiating between the two. It'll go, it's not that spicy, it'll go away very fast. Amazing job, you're doing great. Now, it looks like your nose is working. And it also looks like your eyes, your optic nerve is working. We're going to be testing cornea reflex, and we're going to be testing the objective vestibular assessment now. This is an assessment between sound and visuals because balance changes everything, okay? We're going to move on to motor function after that, so muscular tests, which is the home run. Okay, so what I want you to do is absolutely relax. I'm first going to test your ears. Then I'm going to test your eyes and your ears together. Are you ready? Perfect. This is one of my favorite tests. is a sensory nerve examination because sound with maxillary, mandibular, and especially with the ophthalmic, we're going to be testing your facial senses and we're going to be testing your sensitivity to sound. So, right here I have something that's called a tuning fork, and it makes a sound. I just want you to know if you're able to hear it. That's it. Are you ready? Let's begin. Any sound. Let's try again. Any sound. A little. Once more. Any sound. A little. Magnificent. We're going to move up an octave to a more loud. Are you ready? Let's begin. Any sound. Once more. Any sound. Once more. Any sound. Perfect. And the last one. Let's begin. Any sound. Yes. Very good. Any sound. Good. And the last one. Any sound. Good. Now we're going to double down and test the objective vestibular nerve, which would be the assessment part. And we're testing for fixation on a gaze, which would be with your eyes. We're testing for fixation on a sound, and we're testing for eye tracking. I'm just going to test your eyes first, then we'll introduce the sound. Are you ready? Let's begin. So, what I'm going to ask you to do is sit still, and I'm just going to carefully guide your shoulders side by side like such. Okay? A lot of people think it feels like a massage. Good. So, what we're going to do is I'm going to ask you to fixate only on my finger. Okay? Let's begin. I'm going to just turn your shoulders a little bit, okay? And focus only on my finger. Good. Keep focus, and I'm going to turn your back. Good. Focus only on my finger. Good. And focus all the way back. Good. Focus only on my finger. Good. And focus all the way back. Good. Focus only on my finger. Good. And focus all the way back. Amazing. Now, I'm going to introduce sound now. Are you ready? What I'm going to do is I'm just going to make this sound with my hand. Keep focus only on my hand, okay? And let me know if it introduces any sort of problem. Good. Good. Let's begin. Keep focus. Once more. Good, keep focus. Good, once more. Keep focus. Very good. Now, can you tell me how you're feeling? Are you feeling a little bit of vertigo or uneasiness? Okay, so that was pupil tracking, And that was also an assessment of, it's called vestibular cancellation. I'm seeing if your vision is spontaneous or if you're experiencing something that we call nystagmus, which would be a neural activity response, okay? And we're looking to see if your gaze continually and perpetually follows. Okay, good. I'm gonna try this again, but we're gonna just tilt your head a little bit, okay? Now I'm just gonna carefully tilt your head, just like so. It does look a little bit funny, I know, but just keep your head tilted. Okay, I'm gonna ask you just to follow my finger, okay? We're testing nystagmus. Good, keep focus. Look at my finger, very good, keep focus. Good, and is my finger moving side by side, or is it moving diagonally? Diagonally, very good. Now tell me, is my finger moving side by side, or is it moving diagonally? Very good, side by side, good. I'm gonna look for nystagmus one more time in your eyes, okay? Follow the light. Perfect. I'm looking to see if you're fixating on a certain target. Very good. Keep focus on the light. Don't fixate on the wall. Good. Okay. Very good. Perfect. And keep tracking. Very good. Back to the center. Amazing. I'm going to just carefully maneuver yourself to sit perfectly equal again to me, as you should be. And just keep your gaze a little bit up and make sure that you're not focusing or hyper-focusing on something else. Okay, so it looks like the vestibular ocular reflex cancellation was perfect. It looked like you did not have an eccentric gaze, and the gaze with the eyes with it happens to be driven by the nystagmus, specifically for cranial nerve exams or cranial nerve symptoms. And what we're looking for is 30-degree cancellation, which was perfect with what we saw. I'm going to turn the lights off one more time. This time I'm going to turn most all of the lights off, and we're going to try the direction of your eyes. So let me turn this off here, and let me turn the other one off over here. Okay, and there will be a light behind me. Okay, what I'm going to ask you to do is only focus on the light, because we're looking for your peripheral vision and your dilation with your pupils. As well, we are trying to check and look specifically for the vestibular reaction with your eyes, okay? Good. And I'm just going to ask you just to sit still. We're looking for the ocular motive movement, and we're looking for your eyeball position. Okay. Good. So follow the light. Perfect. Good. Keep right there. Keep looking right there. Good. 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 Follow the light. Good. And look at my hand right there. Look right there. And then, do you see my hand moving? Good. You see my hand moving? Good. And do you see my hand getting closer? Good. And do you see my hand retreating? Good. And do you see my hand getting closer? Good. And do you see my hand retreating? Okay. And then I'm going to just check the 4 quadrants of your eyes. Up. Look up. Okay, look over here. Look down. And look over here. And look right at the center. And do you see the pen light? Good. And now I'm going to just check your eyelids. I'm looking for asymmetry of the eyelids. I'm going to get a little bit up close, and you might hear me just whispering things. Okay. Get a quick look. Okay, I see here what is going to happen right there. So I'm just taking a quick, this is an assessment. So it appears that we are not having any asymmetry with the eyes, and it looks like both of the eyes are reflecting quite well. In fact, with the cranial nerves, it looks like the symmetry and movement is looking super. It looks like the 3rd, 4th, and the 6th cranial nerve appeared to be working correctly, so it looks like we're is I'm going to be looking for a reflex with the lights off. I have this tool right here, and we're here to test the 5th cranial nerve, which is facial sensation. This part is soft, and this part is a little bit sharp. If you can see, it's double-ended. I'm going to just carefully test your eyes with the sharp part under your eyes to see if I get a reflex, okay? Good. Just look at me, okay? Just relax. It really doesn't feel like anything at all. So I'm just going to carefully, right there, I'm just going to. Could you feel that? Good reflex. And could you feel that? Good reflex and right at the nose. Did you feel that? Good reflex. Now, I'm going to look for just a little bit of facial muscular assessment. I told you we'd do the muscle exam. Close your eyes, and I want you to assess if on your face you are feeling something soft or something sharp. Okay, let's begin. So, keeping your eyes closed, let's begin. Are you ready? Very good. Soft or sharp? That is soft. Good. Soft or sharp? Soft. Soft or sharp? And let me know, is this soft or sharp? Sharp. Very good. And here, soft or sharp? Sharp. Soft or sharp? Soft. And soft or sharp? Sharp. Very good. You can open your eyes now. I'm just going to turn the lights on just a little bit. And it looks like your face is able to feel that, which is magnificent. We're going to move on now to a bit of facial muscular tests, okay? I'm going to ask you just to mimic me. Raise your eyebrows up really tall, and I'm going to just put pressure on them, okay? So raise your eyebrows up really tall and resist. Raise them up and relax. Now open your eyes as if you were shocked, okay? Good. And do it for 5, 4, 3, 2, and 1. Good. Relax your eyes. Now close your eyes very tight and resist me from being able to open them, okay? Now close your eyes and resist for 5, 4, 3, 2, 1. Good. And relax. Open your eyes. Now give me a very almost cartoonish smile. Like so, but do not show your teeth, okay? I'm going to put my hands on right there on your face. Good. And relax. Now a very comical frown. Very good. Just a comical frown. Very good. And relax. Now I'm going to ask you to say ah. Say ah. Very good. Say ah. And then also make the sound ah. Very good. Good. And then can you stick your tongue out like that? Good. And then can you just carefully, I'm going to ask you to just relax. I'm going to put my hand right there on your lymph nodes. I'm going to ask you just to swallow, okay? So 3, 2, 1, give it a go. Very good. Good job. And are you experiencing any sort of vertigo right now? No? Okay. And any sort of eyes? Perhaps feeling a bit tired? Yes? Okay. I see that your eyes are getting tired, which is fine. Now what I'm looking for is I am specifically looking for several sets of cranial nerves that we're almost done with, okay? And we're almost done here to ask with the exam. We're just going to finish up with the muscular resistance exam, which is significantly similar to the vestibular exam that I talked about prior. I'm going to put my hands on your shoulders, but I want you to raise your shoulders up, but resist me pushing down. Are you ready? Let's begin. Raise your elbows and resist, 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 resist. Good. Relax. Good. Now raise your arm and resist me pushing up. So you're ready? Raise your arm. Ready? And resist, 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 resist. Relax. Good. Other arm. Raise your arm up and resist me pushing it up. Okay. And resist, 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 resist. Good. And relax. Okay, then I'm going to ask you to do just one last one. I'm going to resist me turning it the opposite direction, okay? So turning your head here and resist me pushing it back, okay? And resist, 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 resist. Very good. Now you can relax. Good. So I have assessed every single one of your 12 cranial nerves, and specifically I have been looking for the vestibular cranial nerve because I was looking to see if it was something that had to deal with your eyes or the function between your eyes and your cranial nerves, and it looks like you are doing okay, but I'm going to ask you to stay here overnight just because we do want to calculate how well you sleep, and we want to study a little bit of your results, and we're going to redo this test again in the morning, okay? Okay, thank you so much for being here. Again, I am Dr. Brain, and today we did finish the cranial nerve exam, specifically focusing on all 12 cranial nerves, and I was also looking for the vestibular objective examination and assessment. So thank you for being here today. It was a pleasure for you to come on by and walk on down to the clinic. I really appreciate that, okay? As well, we will be sending you your results in your email, and it will be right onto your online MyChart, okay? Good. So I'm going to ask you to relax here. There will be a nurse who will show you to a sleep clinic office where you can just relax and enjoy the rest of your evening, okay? Okay, thanks for coming on by.